This week we discussed informed consent, why it's important, and what is required for this to be given. So informed consent is what counselors use to explain to clients their rights as well as their treatment. This should be received from a client before a counseling session ever begins. It is important that this is provided both orally and in written form to a client to make sure that they understand what they are agreeing to. The American Counseling Association sets strict guidelines for what should be included for informed consent to be given. So their guidelines include that a counselor should have their name and credentials on the form, as well as any potential risks and benefits of participating in counseling. Counselors should also include counseling goals as well as techniques that may be used. Arguably, the most important aspect of an informed consent form is the client's right to confidentiality and in instances in which this may not be able to be upheld. So a client does have the right to have their information confidential and not to be shared with other people. However, there are instances in which this may not be possible. A counselor is required to report if a client is considering harming themselves or others, or has been neglectful or abusive towards a child or elderly or incapacitated adult. In these situations, a counselor is required to alert the appropriate authorities, and a client has the right to know that. The American Counseling Association also states that a counselor should include their fees on this form. So Virginia sets very similar guidelines for what should be included. They also take it a step further and say that it should be included that a client has the right to end counseling whenever they choose. So I reviewed an informed consent form from True North Christian Counseling, which is a counseling group based out of Michigan. And this form included information about the counseling group, but not of the counselors themselves or their credentials. So that was the first major thing I noticed that was missing. The next thing I noticed that was missing was that the fees were not included. They did have their cancellation policy and the cancellation fee, but not the regular fee to pay. The informed consent form did include that a client has the right to confidentiality in instances in which this might not be able to be upheld. So they took it a step further and included that they may have to break confidentiality if it were court-mandated counseling and the courts needed information, or if the client chose to sue the counseling group and they needed to use information from counseling sessions in the lawsuit. They did include in their statement that diagnoses may be required from insurance companies to cover the counseling, and that this would have to be shared with the insurance company. Overall, I felt like it was a good informed consent form, but they were missing a few key aspects that I think are important. I was happy that they included information about the cancellation policy, as well as information about what a client should do in an emergency situation when they were not able to access the counselor.